Narcissistic personality disorder is the topic for this video. And a narcissistic personality disorder is a very interesting one. When I first learned about it in medical school a long time ago, there was a classmate of mine who told me that basically anytime you think about this, think about somebody in our class. I'm not going to mention his name, but when she mentioned that to me, it kind of made this personality disorder, come to life. And so you might say, well, what is this all about? Why did that medical student make this disorder come to life? Well, that student fit the description of this disorder perfectly, because he felt that he was better than everybody else, and then he felt that he was, basically the greatest thing since sliced bread, as they say. So people who are part of narcissistic personality disorder are basically exhibiting these types of personal characteristics. So grandiosity, this great sense of, I'm greater than everybody else. Sense of superiority. Also, they feel a tremendous need to be admired by everybody. You can kind of get an idea of what this is all about. They also, I guess a few more things we can list. They demand constant attention. They also are the constant attention or admiration. They also have this sense of entitlement. They also feel that they have special value, much more special than everybody else. They can sometimes be arrogant in their attitudes. And they also, another thing to mention is that they're very, very indifferent to criticism. They don't take criticism very well. Indifferent to criticism. They are extremely sensitive to criticism or failure or defeat. So let's get into some clinical vignettes, and that will sort of put this into a better perspective, I hope. A 24-year-old graduate student and teaching assistant comes into the student health center after being instructed by his college dean to seek counseling. According to the collateral history obtained from the patient's roommates and instructors, the man exhibits annoyingly grandiose behavior and is frequently demanding of his peers' admiration, and has had to be reprimanded for treating his undergraduate students without empathy or understanding, in demanding that their work be submitted in 2 different forms for each assignment. Given this history, which of the following is most likely diagnosis? Well, this is a perfect example of someone who is, even says it, the actual wording is right there in the clinical vignette, demanding constant attention or admiration, extreme grandiosity, a sense of entitlement. So it's a very nice clinical vignette to describe narcissistic personality disorder. Next one. A patient has been coming to psychotherapy for several weeks. The psychiatrist is dealing with counter-transference feelings, including problems coping with the patient's intense devaluation of him as a therapist, the patient's arrogant attitude and sense of entitlement, and boredom during sessions resulting from the patient's obliviousness toward him. Which of the following is most likely diagnosis? Again, feeling of grandiose self-belief, a person who feels they have special value and a sense of entitlement, and that's all describing this particular patient. So again, another vignette that describes narcissism. A 48-year-old actor is admitted to a major medical center with complaints of malaise and cough. He is diagnosed with influenza by the ER physician and sent home, but demands that he be seen by the chief of staff because he feels he is not getting care appropriate to his own importance. On the way down the hall, the man tells the orderly that he should have been nominated for an Academy Award, but was passed over because of jealousy among his co-workers. Which of the following diagnoses best describes this man's behavior? Again, excessive feeling of grandiosity, self-importance, feeling of entitlement, and a need for attention and admiration. So we all probably know somebody like this, and I hope these vignettes encompass what this personality disorder is all about.